Hello, everyone. My name is Dr. Ferguson. I'm here to talk to you about the 5 ways you can introduce cannabis into your system. The first way is to use cannabis as an inhalation. And with inhalation, you're either vaporizing cannabis or smoking cannabis by igniting cannabis. Either way, it gets into your lungs and it circulates throughout your body. The second way to do it is with a sublingual route or oral route. With the sublingual route, you're either using tincture droplets that you place under the tongue, or you can use orally with a lozenge that you stick to the side of your cheek, or even an oral spray. The goal here is to allow cannabis to reside in your mouth for about 5 to 10 minutes. You're not swallowing it, in order for the absorption to occur through the mucosa in your mouth into the blood vessels and then into your circulatory system. The third way to add cannabis into your system is as a suppository. This is for situations where there's difficulty with ingesting cannabis or inhaling cannabis. So consider end of life situations or patients who have specific types of cancers. The fourth way to get cannabis into your system is to have cannabis as an edible. Now, with an edible, from the moment you consume cannabis to the point that you're feeling it, there's a bit of a delay. And this delay is more related to the body's ability to break down cannabis in the stomach and then process it through the liver, which then eventually goes into the bloodstream. Now, it can take up to 30 minutes for some people, 45 in others, or even an hour. But the idea is there is this delay factor after which you can now start to feel cannabis, and you can expect to have time frames of 5 hours, 10 hours, 15 hours, or 20 or even 24 hours of pure cannabis use. The last route, the fifth route, is topical. With topicals, they're different from the other four routes because the other four routes involve cannabis getting into the bloodstream and then circulating throughout the body, so making it more systemic. With topical, you're talking about placement of cannabis in spots and in locations where you're feeling pain, inflammation, or irritation. This could be a patch, cream, gel, lotion, salve, oil, roll on, spray on, anything that goes on the surface of the body but then has to penetrate deep to get to where you need it. Because it is penetrating, you may have some cannabis that circulates through your bloodstream, but because it is small in amount, you won't get that full body systemic effect. You're more getting that localized feeling in the area that you're treating. Okay, so those are the 5 ways you can introduce cannabis into your system. Now, depending on what you're trying to do and what you want to be able to achieve, you can either utilize one route like inhalation or a multitude of routes together.